Right? 'Cause
1:30.
they're like 40
March
now.
14th, all present. Let's start with the Pledge of Allegiance,
All
please.
right.
I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thanks for coming, everyone. Good afternoon. I'll first start with meeting minutes from the 2/14/22 meeting.
Mr. Chair, I'll make a motion to approve the minutes from February 14th.
I'll second that.
Motion made by Commissioner Vetch, seconded by Commissioner Hewsome. Any discussion? If not, move for a vote. All those in favor say aye.
Aye.
Opposed? Motion carries. Review and approval of the agenda. Anyone have anything to remove or add from the agenda?
I'll make a motion to approve the agenda.
Second.
Motion made by Commissioner Dahlheim, seconded by Commissioner Wetter. Any discussion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carries. Next, the consent agenda. Anyone have anything to add, change, or remove from the consent agenda?
Mr. Chair, I'll make a motion to approve this consent agenda.
I'll second it.
Motion made by Commissioner Hewsome, seconded by Commissioner Dahlheim. Any discussion? Hearing none. All those in favor say aye.
Aye.
Aye. Those opposed? Motion carries. Start of the regular agenda, so we have our staffing announcement and new hires.
Good afternoon, Commissioners. I'm Kim Johnson, sitting in for Jamie today, and I'll introduce to you our new staff. So I might introduce you out of order here, so just stand up when I call your name. Chloe Shocker from our office technician area, and Kathy Segner from our office technician area. They're both in Lisa Spencer's team, or on Lisa Spencer's team. Welcome, Chloe and Kathy.
All right, Bill, come on.
Don't sit down yet.
Yeah.
Well, from the chair, I'll just go first to say, do you have anything that you want to say or provide for the board today? Any information? That's as much as I get into it. Now, if the rest of the cast here wants to go in deeper, that's up to them.
So where do you guys live? So you are in the Wright County. You're not in the Wright County.
You're
At least
close.
you're working in the Wright County. Where'd you guys come from? Where'd you work before?
I worked in Starving. I was working at Meese Outland.
The what?
Meese Outland in St. Cloud. It's a power sports dealership out there.
So you got all the good deals on the equipment?
Yeah.
You got four-wheelers and all that good stuff?
Yeah.
Welcome to both of you.
Yes.
Thanks for coming on board.
Next, we have Indaya Casano, and she's on John's team, Health Promotion Coordinator, Health Promotion Promotion.
So, where do you live?
I live in San Michael.
You do?
Yeah, I live in Rincon.
Yeah.
And this is my home.
You're right. And we're sorry that you have to work with John. But it'll be good for you. Build up your strength. Well, welcome.
Yeah.
Congratulations.
Welcome.
Okay, next we have Brianna Doherty, a social worker in our waiver and community supports area.
Brianna?
Oh,
You already know her?
no, I just Leanne, I just feel.
Oh, Leanne.
So where do you live?
Monticello.
Okay.
Oh, so you live in the Wright County too? Let this be a lesson to you over here.
It's the best city to live in.
Monticello? Yes. Well, at least she's in the right county. I mean,
Well, it's one of the best.
I'm biased.
Yeah.
I don't know. I think St. Michael's a better one.
I mean, it's one of the best 17 cities in Wright County.
It's better living in the country. What do you
Okay.
mean? Live in a township.
Or the 18 townships, yep.
So, you said you live in Monticello?
Yep.
Where do you work for here?
Hennepin County.
Okay.
Ah,
Nice to get somebody from Hennepin County.
you'll like Wright County a lot better.
That might be so.
You'll have to.
I already do, so
Oh, all right, okay.
And a
Yeah,
shorter
we're counting
commute,
on
huh?
that.
I'm working on it.
All right, all right.
Okay,
So next
Yeah,
are
welcome.
3 eligibility specialists from financial assistance, all which report to Michelle Dunn. So just stand up when I call your name. Maddie Orr, Justine Hagan, Cody Galvin.
Welcome.
sat together.
Welcome. So, where are you guys from?
I live in South Haven.
Hey,
Oh, wow.
I got you.
3 for 3, all in Wright County.
Oh, I wish.
and 2 of them are my constituents.
Did you say South Haven?
Yes.
Oh, I thought South Haven was in Wright County.
It is, it's my city.
But you said you don't live in South Haven.
No, part of South Haven, down in Kingston Township, and we're down in Meeker County.
Oh,
Just
you
over the
are.
border. I can throw a rock.
So you have, okay, close.
Oh, well. Maybe we can annex that. You can, talk to all your neighbors and,
I'm in.
oh, welcome all of you guys.
Yeah,
Thanks for
welcome.
coming. Thanks for becoming part of our team.
Yes,
All of you.
and soon we'll be in a new building.
Next, we have the Employee of the Month for April.
Yeah, we do that.
Okay, so taking a page from Jamie's book, I think I get to invite Lisa Wilson to come up here. Our April Employee of the Month is Lisa Wilson. Lisa is our MinChoices Reassessment Social Worker in the Reassessment and Supports team. Lisa joined Wright County in August of 2015. Lisa's nominators say Lisa is an expert with MinChoices and MMIS and is always willing to stop whatever she is doing to help her coworkers. There have been countless times that our team will have an issue with a screening or with the MinChoices application, and Lisa will jump right in to help. She always helps with a smile on her face. Lisa is very patient, knowledgeable, and willing to help others with the MinChoices tool and entering screenings in the MMIS system. Lisa is a team player who willingly took on the extra responsibility of becoming a MinChoices mentor and is doing an exceptional job in this role. She is quick to respond to others' requests for help, often putting their needs in front of her own to ensure that coworkers are still able to meet their deadlines. Lisa takes on this extra responsibility with grace and a positive attitude. Lisa helps others at a moment's notice. You can always rely on Lisa for help. Lisa came to Wright County with a wealth of knowledge, already certified as a MinChoices assessor from another county. Lisa was instrumental in training Wright County employees on MinChoices and entering the screening documents in MMIS. Lisa is a vital part of reassessment and supports, and we are very fortunate to have her. Thank you, Lisa, for your willingness to help with a positive attitude, and congratulations on being our HHS April Employee of the Month.
So you work in this building?
No, I'm at Human Services.
Oh, okay.
Yep.
So I have one thing to add. I got to meet Lisa when she was volunteering for the vaccine clinics. So there's probably a million more things we could add to this list. So here's your certificate of achievement, and I'm sure if you'd like to say a few words, they'd accommodate you, but.
You should give us a warning. We had to prepare a speech, because I didn't prepare one.
So does that certificate give you like a permit to pick your cubicle in the new space?
I already did before I got this. I have
Oh.
a window.
You have a window.
I'm told to dress in layers that I'm gonna get hot.
Oh,
So I'm excited to be warm for the first time in almost 7 years.
yeah,
Well,
Yeah, that southeast
congratulations.
side, that sun is pretty intense in the morning.
I'm pumped. If I ever have to wear winter clothes in August, that'll be
yeah.
awesome.
Hopefully.
Hopefully.
Hopefully it'll be a lot better over at the new building.
Yes,
Thanks for
Yeah.
a good job, Lisa.
yeah,
Yeah,
thank you so much.
congratulations.
All right. Next, we have 2022 Mental Health Advisory Council Unmet Needs Report.
So I
Eric.
think Eric Nagel is coming to the front.
Good afternoon, Mr. Chair and Commissioners. As you know, yearly we provide an unmet needs report. This is the 2021-2022 report. We have a responsibility as the MHAC to present a report of unmet mental health needs, both of children and adults residing in the county. And obviously, it's not the most exciting report to give, but one of the things that I can tell you is that it's been an interesting year. A lot of things happening. So one of the things that I would like to start with is saying that the Mental Health Advisory Group has spent a lot of time having conversations and trying to figure out what are the things that we can do better. And the county, I'd like to just say, I think Wright County does a fairly good job of meeting the needs of people with mental health issues. So, but one of the things that we talked about is homelessness. There still are some concerns about homelessness within Wright County, but there have been some efforts made by Salvation Army. There's a program that they've been working on providing 24-hour-a-day support for homeless clients in need of placement, and I believe it's short-term. And Blue Plus has let us know that they have started a housing flex fund in April of last year to provide some funding for programming, and CAMI received some of that funding. And stop me anytime if you have questions. The psych services in the jail is something that was addressed, I think, before the pandemic, and has been a successful implementation of different things, and the telepsych availability has been something that's county-wide been an issue, but within the jail I think has helped. Obviously the DAs for clients who lost insurance, that was a concern when they're in jail. How do we get them insurance when they're in jail, and then when they get out, do they have insurance? And then obviously jail program with the county for expediting the DAs was a successful rollout, and part of that I think is due to the adult mental health social worker that you provided funding for within the jail. So that's a positive thing. Transportation obviously remains a question within Wright County, and right now we're kind of wondering what's next. There were, I think the county board here, as well as other entities within Human Services, looked at Dakota County's pilot and decided it maybe wasn't the right thing for Wright County. And then we've had a number of individuals in the Mental Health Advisory Council who are foster parents. And one of the concerns we have, I think, and this has been an ongoing thing throughout the pandemic and before, is there weren't enough, and there still aren't enough foster homes for children in Wright County. And the main need was for CFC providers that will take teens and adolescents. So not having enough foster parents that will take a teenager. And then also the high needs children as well. There's just not enough, I think, mixture of foster and therapy within that spectrum. That's something that still needs to be addressed. One of the things too was that staffing concerns in the corporate foster care homes, that there wasn't enough staff and they were working extra hours to try to keep up, and obviously creating some stressful staffing patterns for them to try to keep everybody on schedule and not being burned out. We talked about more frequent opportunities for the community to attend trainings on mental health concerns, and there have been some trainings that have been provided by CAMI as well as by Human Services. And you can find that information on minnesotamentalhealth.org. And as a provider of services to the older adults in the county, there's still quite a bit of social isolation, and elderly citizens often right now especially are facing mental health concerns that they don't know who to talk to, they don't know how to navigate the system as well as maybe younger people do, especially if it's something that's the first time that they've encountered it in their lifetime. What else is next here? Mental health first aid training for non-provider county members is something that that was a discussion. We felt that was an important thing to implement. at some point in the next year. Mental health service models that are built for in-person sessions. And so some of this, the learning and the education that's provided is really can't be done in the best way virtually. But some of it's been done that way during the pandemic. We had a conversation about building within Wright County a coalition of food shelves, because I think one of the stressors that people face in Wright County is not having enough food. So we looked at other models, and I know personally that some of the food shelves are providing some mobile support to people in the community, but not enough is being done to provide services for those people that can't leave their houses. So if it's an older person or a disabled person, more could be done there. And obviously Medicare does not provide insurance for individuals seeking mental health, and so that's still a concern. I don't know how we fix that, but that's one of the things that we've talked about. Community members and clients are unaware of case management options. So sometimes people don't understand how the insurance company and the case manager work together to solve the problems for their mental health, and more could maybe be done to help people understand that, whether it's workshops or something like that. There have been some discussions about internet access and device access for telehealth. There was a program that was provided. I think CAMI was involved and a number of other organizations involved, as well as the Central Minnesota Mental Health group, in providing some tablets and things like that for people to be able to access mental health. And there are some funds available for improving internet access throughout the county, and obviously you are part of that solution. The mobility is something that we talked a little bit about. The public health departments were struggling at some point during the year to connect people, and this would have been last spring with the vaccinations, and actually they did a really good job, to be honest. I think that we, in partnership with some other organizations, including WCCA, we were able to get a lot of people vaccinated. I don't know if that continues to be an issue, but it was something that we discussed, and I think we worked through it. And then one of the things that came up was the sliding fee scale services for kids who need mental health services. How does that work? And Central Minnesota Mental Health offers sliding fee scales. So we did discuss that and kind of came to a conclusion that that there are other organizations as well that provide sliding fee scales, and parents and even teachers might need to know that information, or maybe could benefit from knowing more about that. Again, here's transportation issues in Wright County. I don't know why that's duplicated, but and then community staff shortages creating multiple and deep impacts. We had conversations about all the employers that are struggling to maintain their businesses because they cannot find staff, and a lot of times it's a community provider like nursing homes or other organizations, and so finding ways to help organizations find people and hire people. And we've also had a lot of individuals talk about the workloads and how essentially a lot of the people within organizations that even at the higher level are suffering from burnout. And so we have some disengaged staff in some of those organizations. And then in this last meeting, we had a conversation about bullying in the schools. One of the council members was interested in seeing what can be done, because there's a growing concern within the schools that bullying hasn't been addressed, and if it's being addressed, it's kind of being addressed in a more complacent way. The Safe Schools meetings maybe that take place within the schools often have a liaison officer available, but sometimes I think that the conversation is, well, we've done what we can do, and so there was conversation about how maybe Human Services could take a role, or even this committee could take a role in maybe some new ways of thinking about how to deal with the bullying within the schools. That pretty much concludes my presentation. Do you have any questions?
Questions?
My only question was, what's DAs for clients?
I'm assuming it's diagnostic assessment. Is that
Okay.
correct? Yeah.
There's lots of acronyms and I don't know them all.
They come all the time. Any other questions?
What'd you do with your book, Eric?
I don't know,
Thanks for
where it
coming
is.
in and going over this. How does this compare with last year's list?
Actually, to be honest, I think that despite the fact that we're in the midst of a pandemic or have been, I think that Human Services addressed a lot of issues over the last 2 years that maybe hadn't been. So I would say we're doing better than we were a year ago. I still think that there's a lot of stress that's maybe different than what it was, a year and a half or 2 years ago with the pandemic happening. And I think it's affecting different levels of people within the community. So it may be, I think there's still a lot of stress that kids are facing in school and trying to navigate, when am I going to be at school, when am I not going to be at school? And I think that that's passed on to the parent, and so the parents oftentimes I know that the administrations within the school have had they've had conversations with me as well as others I know who have said, we're working at it. It's tough, we got to fix this, but we're working at it. But I think overall, the county seems to be addressing the mental health needs of people. And I think there's maybe 2 areas where there's really a need for maybe more of a look, and that would be the foster kids, I think, and maybe the older adults in the county. And obviously, we're all facing stress at work, and we're facing stress in our family lives and things like that. So being able to, I think, find the services is maybe one of the things that the Human Services Department could do more outreach. The county could do more to say, hey, we're here to help you. We want you to be healthy in your home, and we want you to take care of yourself and your family. So, but I think that ultimately, yeah, I think that the Wright County Human Services and Public Health are doing a great job.
So this is a mandated report, but none of these are mandated services per se.
No.
Is that right? Okay.
That's correct.
All right. Thank you.
Thank you.
Thank you.
Thanks, Eric.
All right. Next, we have the update on drug testing with Michelle.
Afternoon. Just a couple of comments related to the unmet needs report. One of the issues raised was foster homes for kids. Our licensing supervisor just gave me an update that we have 11 homes currently being licensed, which is a large number at one time. And we have
11 non-kinship homes, correct?
correct.
Okay.
Correct. Yep. And our kin homes we're over 70%. We've got a very high ratio of kin homes. So that is really good news, and those aren't even related to our current outreach and recruitment efforts. That we have a new staff, Robin, who is our truancy case aide, who has fantastic relationships with all 10 of our school districts. So she's done recruitment, but these 11 homes have come in through our Facebook posts and other things. They aren't yet connected to the work that Robin's doing. So we're expecting to have a nice, to look at some nice numbers of foster homes for kids. And yes, as Eric said, definitely related to our teens is a high need, and especially related to shelter. So I just proposed an on-call plan to Jamie for our shelter needs. Currently, we are at the point where we have had some kids have to stay at Lino, which is a terrible shelter option, absolutely terrible. And so we've devised a plan, and we're in the process of talking with our homes on would they be willing to be on an on-call basis for, whether it be a male child or a female, 0 to 18. And so we're putting a plan together to hopefully avert any use of Lino Lakes for any of our kids who that would just absolutely further traumatize a kiddo. So sorry to take a.
So in those stays, what are the stays on those, a lot of these teens? Are they short-lived stays? Because, if you're sending them to Lino
For
the
shelter.
trauma side of it, it's got to be very, very short stay, I'm guessing, because we wouldn't want.
A sheltered stay is typically 3 days.
3 days?
So 72 hours. Yep. So it's not long. I think the issue is there just aren't that many homes willing to take teens. So it's kind of we're trying to do some education and just, teens don't have to be scary. They aren't scary. I have 3 right now. They're not terribly scary. But anyway, just to answer that question related to foster care. So the drug testing update is, if you remember last fall, we ended the contract with Total Compliance Solutions that were formerly Rockford Testing. And, you know, there was a long history with that, tried to communicate, there were just some poor practices, lots of concerns that weren't getting addressed. So we ended the contract last fall, and we'd put out an RFP, and we are just finalizing a revised contract with Minnesota Monitoring. So we already had a contract with them. We've just added an amendment for on-site testing. So once we move into the new building, the plan is April 4th that they will start doing random testing and utilizing a restroom on our floor. And that will be on a random basis that they will determine. And then we're also going to add in some Saturday testing. So they will use the jail lobby like probation uses currently to do a couple of Saturdays per month. So that will also be an option for testing. So we're excited to get that started, and everybody's on board with having one of our bathrooms on kind of in our intake area used for those purposes.
Good.
Mr. Chair?
Yes.
Who is Mike's group? Who are they using for drug testing?
Their staff.
Their staff. So are they testing different things than what you guys would be testing?
Similar things, yep. They also use Minnesota Monitoring, so it really is, so we use Operation Foresight, Minnesota Monitoring, several, it's where are people located? Is there a testing site close to where they live or work? Then test there. Otherwise, their probation agents do testing.
Because all of our drug testing is mostly around child protection cases,
Correct.
almost exclusively.
Mm-hmm. Correct. Yes.
All right. Thank you, Michelle.
Yep.
Yeah, thank you.
Next, we got a presentation on the new government center lobby check-in process and queue flow from James.
Afternoon, Mr. Chair and Commissioners. We are excited to be implementing queue flow for our lobby management event and scheduling solution for the new building. And we provided some preliminary screenshots in the board packet. We wanted to take a little bit of time here and just walk through a quick example of what it's going to look like. So what you see on the screen here is a web view of what the kiosk will look like. I have to say the kiosk will look a little bit different than this. Things will be more proportioned. So if you think those buttons are way too wide, they don't look that way on the physical kiosk. So this would be what a client would see when they came into our lobby and wanted to use one of the kiosks on the wall to check in. I'm going to assume that no, I don't have an appointment. I'm here for a walk-in. And then we're presented with the options that most clients have when they walk into our lobbies. So 80% of our walk-in clients will be in those first 4 areas. We have an other services button for things that people might walk in for and go to the kiosk that range from picking up a radon kit to getting a pregnancy test, those kinds of things. But we wanted the front page here to be really clean, so I'm going to just say that I am here to apply for something. And then whether you need social services, financial services, or child support services, we have your options here. I'm going to say financial assistance because I see there, hey, SNAP is there, and I'm wanting to fill out a SNAP application. So I touch that. It wants my phone number, which is going to just be used for managing what's called the lobby case. And see if I can remember my phone number here off the top of my head. 9823. And what will happen, you'll notice here, if the client doesn't have a phone, go to the front desk. We don't intend the kiosks to replace the front desk at all. And the front desk staff will be willing to assist anyone who wants to come directly to the front desk. But I say okay there, and then it's going to ask for my name. I'm going to say Jim. Oh, and then I get some options for my ticket. I can receive an electronic ticket. Yeah, if we have a lobby, the lobby full of people, I may want to go downstairs and grab a coffee. The system is going to tell me when I'm third in line to maybe return to the lobby because you're going to be called soon. I'm just going to say here, no, I want to get my paper ticket so that I have it in my hand. And then you get the page and you can have a seat until you're called. What that then is going to look like to our front desk staff here is they'll see in the various service queues for which they're monitoring, they're going to see the appointments come in. They'll have a wait time as well that will be displayed. You can see my ticket right there is T902. If I look at the wall display, of which we have two, so you can see the wall displays no matter where you are in the lobby, see that my ticket is the next to be called there. We also have public service announcements that can be displayed. Those can be pictures or videos. And we have the banner running across the bottom too that can offer more information that clients will be interested in. And then I am going to go back to the service console. I'm at the front desk. I'm calling my next person because I just finished with the one that was right ahead of this individual. And so I do that. What's going to happen on the display is we'll get a now serving. That location won't say window 1, but it'll give the proper location. This is a dev environment. There also will be an audible announcement for that ticket number, and they can come up to the front desk and be issued their SNAP application. Then, if the person wants some additional help, say I get the SNAP application, but I really want to talk to a financial worker in order to help me fill this out because I brought information that I thought I would need, but I need a little help. What the front desk attendant can then just come right down to some of the information that will be kept here, and this is just going to say SNAP application, and I'm going to make a note here. Client assistance with SNAP application, and then I am going to save that. But of course, on my screen, the little window that shows everybody on camera is down there. So let me back here. Joshua, what am I doing wrong here? Is that enough? Yep, that's next, but it auto-saved the information. And then we will send that to the financial assistance worker who's going to be up front in one of the consult rooms. The financial services, it's a case question is what it's going to be. And that ticket will then go back into queue. As soon as that financial assistance worker is finished with the person they're seeing, they will then call that person in and assist them with their ticket, so with their application. And you can see here, it's now in the financial workers queue, and I'm gonna call that, and then we can finish that case. You'll notice here a couple of things that are going on in the metrics section. So we're collecting time on how long clients are waiting in the lobby, And then we're also, by routing this way, we're also collecting time on how long it actually takes to serve each person in the lobby. So we'll be getting a lot of additional information that we don't have today. And we think it's really going to be a big improvement to our customer experience. This also affects our appointments. So family home visits, social worker visits, for someone to come into the office to meet with their social worker, they'll be able to make an online appointment. That will integrate with the social worker's Outlook calendar. One of the major reasons why QFlow is such a great product is it has that two-way communication with Outlook, so it can see when their time is blocked, or it will add appointments to their Outlook calendar that clients want to make online. So that is another big benefit. Are there any questions?
Mr. Chair,
Yes.
how many kiosks are you going to have, Jim?
We have 3, and they're wall-mounted. 1 is wheelchair accessible. Yeah. And we went with 3 because many times we'll have events where a lot of people are needing to check in at once, and that's going to be a big help.
Do we have plans to add more, or do we figure for that for the future if ever needed?
There is room on the wall to add more. Certainly we could add more if we think that's needed.
But it wasn't wired for it or anything?
We didn't wire for more right away. We thought 3 would meet the need of the largest events that we currently have. And then, but, you know, should other departments within the county decide, hey, we could use a queue management system, it would be very easy for those departments to purchase their own kiosks if they wanted to use kiosks and integrate with this system. So
You couldn't utilize a tablet or something?
you could, but it would need to integrate with the QFlow server. So it's not hardware dependent. We certainly could buy our own hardware and integrate with that.
So you could have like a QR code and picture it and bring up the thing on your phone and log in via your phone.
Yeah, absolutely. So we could have a QR code that would then bring someone right to the, say you need to make an appointment with a social worker to discuss a mental health case. We could have a QR code that went right to that. And they could
But
make
even
an
just to
appointment.
log in to get yourself on the waiting list, you could do it right from your phone
Yeah.
by just scanning the QR code. So there isn't, the only reason you have the kiosks is for somebody who either A, doesn't want to use their phone and wants to use the kiosk, or
Yeah, so you're right, Commissioner. So a person who creates an online appointment, they could come to the lobby and go back to the kiosk here and say, yes, I do have an appointment, and then it's going to ask them for their phone number and find them and pull up their appointment and show them who they're here to see, and then it'll also alert the person they're here to see that they're here and have checked in, or alternatively, they can check in from their phone as well. Yep.
so they can basically come in without an appointment and just they put themselves on the queue from their phone.
No, they cannot do that. So what we do is we treat same-day appointments as walk-in. So if someone wanted a same-day appointment, they would need to come in and either visit the front desk or go to the kiosk. Online, the soonest they would be able to make an appointment would be for the next business.
Okay, so you can't put yourself on the queue from your device at this time.
Right.
Yeah, that'd be a change if we would want to do that, but versus adding more kiosks, you could probably add it so that would be an option from a phone for a person to be able to put themselves in queue from their phone.
Sure. Yeah, absolutely. We can do something like that.
Yes, Commissioner Wetter.
So say it's me and I'm not tech savvy, so I just go to that person at the desk.
Yeah. Yep.
Now, does that person at the desk, can they work from there, or do they have to go to the kiosk
Yeah.
and work with whoever is helping them?
That's a great question, and the answer is both. So we could have someone, initially, I think people are going to want maybe to have someone who's available to help with the kiosk. But really, if someone comes in and goes right to the front desk, that front desk attendant will be able to enter and create the appointment for them without them having to go to the kiosk. They would enter it right into QFlow so that we still get all the tracking capabilities, but they're using a different interface from the kiosk interface to get that appointment created.
Because there's a lot of people out there that just refuse to be
Oh, absolutely.
IT,
Sure.
you know.
Yeah, and some people just want that face-to-face interaction too, and we don't want to take that away. We
Okay.
just we want to provide the additional option for people who may think it's faster or want to do things without the interaction, and it just gives everybody the ability to have the experience they would like to have.
It's like going to McDonald's, whether you want to go up to the counter or work with the kiosk and
Yeah.
get your burger that way.
Exactly.
If they're set up that way, not all McDonald's are that way, so.
In fact, our technology coordinator, Joshua Kwalik, who helped me a lot in developing the screenshots for you all, thank you very much, Joshua. He came to us from McDonald's, and was one of their lead individuals in the area for installing those kiosks in the different
Oh, wow.
McDonald's stores.
So you're telling me I could go up to the human services and order my McDonald's, my burger? Oh, come on.
We didn't integrate that.
Jim,
That'd be another added bonus.
Well, Mr. Chair, I think they did a great job in terms of making it very intuitive and asking the questions that they need to get people through it very, very slick with the least amount of
Yeah.
least amount of screens to get there, so.
Yes, yeah.
Jim, can you go back to that screen where you pick your business up there, you hit apply?
Sure. Let's see. Oh, and
Right, there you go.
You want me to hit apply again?
Well, just bring that menu up so I could see it again.
Oh, sorry about that.
Come back,
I thought
maybe.
I had. Sharing that again.
I can ask my question. So I'm wondering, so you talked about hit apply if you want to apply for service. Well, you're going to have a lot more foot traffic, brand new building. Maybe someone's going to say, geez, I'd like to work here. If they hit apply, can they look for job openings? Apply for a job?
So application from Health and Human Services standpoint generally means application for services. So we don't have any human resources functionality behind that button. And I would think, so if a person did that and they didn't see, they would just step right over to the front desk and say, I'm looking to apply for a job and I didn't see it on the kiosk. And we could direct them up to the third floor to human resources.
I just know from past, the buildings had the bulletin board with all kinds of positions listed, and it wasn't necessarily human resources, so I thought, well, if they
Okay.
wander in here, apply could be either way, but I guess it's not set up for that.
Yeah, if, you know what we would do though, if we see that happening, it's not any issue at all to add a service for that to our kiosk, and we certainly could do that.
All right, thanks, but you're gonna have a real person at the desk yet, so that's
We
nice.
certainly will, yeah.
All right, thank you.
Great, you're welcome, thank you.
All right, next, under administration, the fourth quarter financial report from Christine.
Good afternoon, Commissioners.
Afternoon.
The dashboards were included in a link in the agenda, so if it's okay with you, I won't display those. I thought I would go through a review of 2021 and talk about the line items that were either above or below budget of $100,000 or more. And there's only 16, so it's not going to be entirely, a very long presentation. First of all, we finished 2021 with almost $1.2 million more revenue than expenditures. It's pretty exciting for us to finish that well. We had 97% of our budget for revenues with 93% of our expenditures. Of that 1.2 million, a large percentage of it was related to salary and fringe. Most of, that's $986,000 was the amount that we did not spend our budget for salary and fringe. 300,000 was related to financial services, 438,000 is related to social services, 42,000 is related to public health, and 195 is related to administration. A lot of what you're seeing is the dynamic with the Great Resignation. It's taking us longer to fill the positions. We're having a harder time finding qualified applicants, and we're experiencing higher than average turnover for health and human services. As you're aware, the impact of not being fully staffed also impacts our revenue. Time study revenue is based on expenditures. So as our expenditures decrease, so does the time study revenue. In the cases of other areas like targeted case management and waiver, if we don't have people to complete those visits, then we don't collect that billable revenue. Another big area is payments for recipients. That was under budget by $628,000. The largest portion was related to social services, which was under by $545,000. The biggest area within all of social services for payments for recipients was substance use disorder, also called behavior health services, and correctional facility placements. That was under budget. The areas that were over the largest amount in social services was adults, regional treatment facilities. I had a complete mind blank on what RT meant, and child residential placements. So some were down, some were up. Overall, social services was under by a pretty large amount of money. Then we have 6485 and 6260. If we talked about that earlier in the year, we had coded a budget to 6485 for software. It ended up needed to be charged to 6260, which is also software. So those two, when you net them together, are pretty close. There was some additional expenses in 6260 because of the call center that was approved after the budget. We did run the expenditures through financial services so that it could be charged against the time study revenue. So overall, that was, between those two, it was a net of about $95,000 over, which is the call center. Also under budget is 6261, which is professional services. That's under by $128,000. There was underspending on the contract related to fraud and the fraud prevention grant. The MTM medical assistance access contract was also under budget. And the grants for contracts within the public health different grants, those professional services were also under budget. So overall, $128,000 less than we budgeted.
That MTM grant annual, or is that rate that we pay, is that signed up for like a 2-3 year?
MTM is an annual contract, but they negotiate for a longer time period. And I think last year we knew that it was going to go up, but we didn't have the dollar amount yet.
But and then the amount paid to us is based on the utilization, right? Because we contract the rate with them with the consortium, and then we base it on the utilization. Okay,
Yes.
yeah.
So if there's higher utilization, our amount goes up. If it's lower utilization,
And we don't know what the utilization is from year to year, so, yeah.
Well, we do know because we do have utilization on each of the invoices we pay. It's just not a part of the
But
financial.
when you're budgeting, you're guessing how much you're gonna get, how many people are gonna use it,
All right, so that takes us through the big ones for expenditures. On the revenue side, we had 5512, which is our vaccine revenue. That was over budget by $282,000. Again, that's the COVID administration fee that we collected when participants had insurance. We did not bill anybody that did not have insurance or did not provide insurance. Another one is 5501, and that was the largest COVID vaccine grant that we received. It was over 700,000, and then we received another amendment. So the 213 that it is over budget in 2021 is related to the expenditures for 2021, and that is an ongoing grant through, I believe, 2024 at this point in time. Also related to COVID is 5327. That is over by almost 136,000. That was a new grant early in the spring, directly related to the vaccine implementation. Then we have 5501, which is our fees area. That one includes the $100,000 Blue Cross Blue Shield Dental Coordinator grant that we received after the budget was completed for 2021. It also includes a $10,000 and another $25,000 that we received for the dental care clinic. Then we have 5495. We had 102 additional funding in there, and that's for the drug-free community grant that we received right at the end of 2020, so it wasn't in the budget for 2021, and that is now in the budget. Under budget is 5421, and this is your IMRMS revenue related to TANF, child support, and MA. Again, as we talked about, as expenditures drop, then our time study revenue goes down. Same thing with 5471, which is $237,000 under, and 5371, which is $202,000 under. That is your min-choice time study revenue. That's also down significantly. And the last three I have is 5363, which is our SHIP revenue. As staff focused on vaccines for a good portion of the year, the time coded to the SHIP grant was down, so the revenue related to SHIP was also down. Then with 5384, that is our evidence-based home visiting grant. We had asked for one new position that would start July 1 of 2021. There were some changes in the, this is a grant we share with other counties. The other county hired that position, so rather than filling it for this grant, we transitioned that position to one of the new grants that we got for COVID, and so the early home visiting grant revenue is down because there wasn't staff time coded to that grant. And then lastly, 5001, which is just general property taxes, and this one is pretty interesting because it's at 99% of the budget, which is pretty darn close, but it's actually 127,000 short of what we were targeting. So those are the key things that I thought would be important to recap for the last year. Are there questions that I can answer for the board?
Why are you looking at me?
Because I'm counting on you to have a question.
Wow, any questions? All right,
I'm good.
thanks for coming in, being available, and there was 42 pages worth, and I didn't know what you were gonna cover, how much today. I'd like more time, I guess, if we could put on the next one as needed, and I can get with you before the next meeting and maybe rule some of mine out. I had some, I didn't set a threshold of 100,000. So I got some lower that I would ask about.
Okay.
And I'll just throw one out there, just for general understanding, overtime. Under, well, I'll say it's reference page 24 of 42, under 430, public health expenditure. It doesn't show any money budgeted for overtime, if I'm reading this right, and 26,000 was spent. Do you typically not budget overtime, or?
Yes, so the past direction has been to not budget for overtime. And when I gave you that overall of the salary and fringe being significantly under, that included the overtime amount. So as we have vacancies, or in this particular, I mean, that's public health, so that was directly attributed to the COVID vaccination projects. That's all then billed to the grant as well. This past year, overtime was probably higher, specifically related to public health, but in general, our overtime is fairly small compared to the overall size of the salary and fringe budget.
Okay. All right, I won't take up a lot of time because I think we can flesh out some of the others that were smaller.
Would you like to just, you and I set up a separate meeting and we can
Sure.
talk through all of it? Okay.
And then if we got to revisit something when Jamie's here at the next meeting, we could just say as needed, budget review.
Okay.
All right?
I'll have Amy set something up with our schedules and then we can talk through all your questions.
Okay,
Great.
thank you.
Any other questions?
Thanks, Christine.
All right, thank you.
Nice to hear that, that you were over.
Yes.
Yes.
But I'm sure, because a lot of it had to do with public health and vaccinations, and there was some of that other money that was available too that kind of paid for it, right?
But 900,000 in unutilized staff time, that's
a lot.
That's a lot.
That's a lot.
That's,
Scary.
And it's hard on staff that are still
Yes.
working to continue to carry a higher than average amount of work.
We get all these new people now, and they all seem to be bright-eyed, bushy-tailed, and it should take us at least a couple of months to burn them out.
Well, we're aiming for longer than a couple of months.
Oh, okay, good. So this crop is a little better to be expected than the last one. Okay, good.
hey, but it's, Mr. Chair, I mean, it's really, businesses, whether you're government or private, you have to really look at how you operate your business differently. And you have to almost take into the accountability a 10% or even a 15 to 20% vacancy part and try to build your operations around knowing that between vacations and the fact that people don't necessarily stay at the same place for 5, 10, 15, 20 years, that they maybe only stay there for 2, 3 years. So you have to build your operations that there is going to have to be excess people at times because people leave. Things that
But
you
don't any of you leave.
Mr. Chair,
Yes, Commissioner Witter.
now that opioid settlement, does that stay in Health and Human Services, or does that go just to the county? Or,
and that's paid
or
out
will
over
it
time.
really be the 1.2 million plus whatever that was? I don't remember offhand.
Mr. Chair, but I thought that was paid in over an extended
Oh,
period of
that's
time.
right. That was
years.
over
It's paid
time.
over 15, 18 years.
Yeah,
And
that's
and it's
right.
got very detailed things on what you can spend it on in terms it has to be spent on drug education,
Okay.
things of that nature. And Sarah can probably speak to it way better.
But that should help those areas though, right?
I'm gonna address that in the director's comments.
Okay, oh,
That
that's
portion
right.
of the agenda, I'll give a little bit of an update.
Okay.
All right, that brings us to director's comments.
Am I the only director?
Other than what I have to finish up with.
In lieu of the director not being here, we'll have director's comments.
That's with director's comments.
Yep.
Yeah. I was directed with my director's comments. Good afternoon, commissioners. So I have a few director's comments. So the first one, I will do the opioid settlement. And of course, I opened a different thing and I didn't open the settlement, but we did, on the Attorney General's website is the amounts for every county. And I remember distinctly the private attorney sharing that you would expect about $1 million. I believe I whispered to somebody, probably Greg, that I thought that was a low ball on his part, probably to protect his reputation, which is understandable. We have met all of the requirements to get the bonus money except the last one where the state legislature has to pass a bill, and that bill is, I think, if it hasn't been introduced yet, it is just about to be introduced and should meet the March deadline. And then that will free up all of the bonus funds. The allocation for Wright County is $3.77 million. But you are correct, Commissioner Vetch. It is over 18 years, and how it will be dispersed to counties is not clear. I believe there was the recommendation to set up some specific type of trustee. I shared that information with Brian and Greg when it was presented in the negotiations, and I was not a trustee. I'm not a lawyer. So that one was over my head, but they said, oh yeah, that's sort of common. It's like a retired judge would likely oversee this pot of money. And I am not clear, like similar with ARPA funds, I know the county took a position to invest some of them because we had time to spend them. And so I don't know if there's a lump payment to the state and they are going to invest some so that it can accrue some interest. I really have no idea. And there are reporting requirements and auditing and accounting requirements as well. We'll know more as we get closer to August. And I thought I saw, yeah, Administrator Kelly it looks like is on, and how it will flow into the county, it will also be dictated. I believe it has to be in a separate account. So.
More to come.
Thank you for your work on that.
Well, I know some counties were disappointed. I was very happy with the amount that we were receiving.
Mr. Chair?
Yes.
Is there any ideas when, I don't know how we're meeting or, bringing forward requests essentially, or how all that might shake down because, as I mentioned, Central Minnesota EMS has, they don't have a stable funding mechanism. And so they've had to cut back on the trainings and that kind of thing for the fire departments, local fire departments. They used to give grants for a lot of things, but they also provide Narcan to the different law enforcement agencies and fire departments, EMS. So just wondering about if we have any idea. We're gonna be meeting again next week, and I think we're amenable, perhaps. I mean, I can't speak for the whole board, but certainly it seems like a very legitimate. They're working with overdose people on a regular basis, and so anyway, just any. I guess the other counties will probably have the same idea, answer. We don't know exactly when this is coming, or how the counties are, what they're willing to do, or that kind of thing. And I'm not asking for any kind of decision or anything like that, but just a ballpark, wondering when this might start taking place or when we can have those discussions.
So I think that is something that I would like to meet with Administrator Kelly about. Public Health is tasked with setting up the conversations, but we have many interested parties,
right,
as well as all of our municipalities that had to sign on. So we have 3 or 4, Otsego, St. Michael, Buffalo, and Monticello. So 4 met the threshold. So they are all expecting to be invited to a conversation as well to direct those funds. It was based on population for those of you who felt like your city wasn't mentioned.
So they're getting their own set of funds.
No, they weren't
They have to
large
give-
enough, but we have to coordinate with them.
So we have to give them some of our funds?
They have to be part of the planning process.
Or the approval or whatever, how them funds. So you may create a little sub-council that reviews the grants and the expenditures and makes recommendations that come out of it. You don't know. You have to set together some sort of an individualized process internally here that meets the rules.
Right, and the rules, that I would say that is the one thing that we did not finish was, and I let you know that, Commissioner Houston, we don't know the reporting or accounting process, and because we're a larger county, what they were, in my understanding to the Attorney General's office was they were to right-size this, because places like, is it Cook County that's way up north, the tiny one?
That's one of them.
They're getting like $5,000 over 18 years, so,
Yeah.
that a very complex accounting requirement is just, they're just going to say keep it. Right? Because they'll spend more than $5,000 on reporting.
And then I'm interested to find out, because if I remembered, it was front-loaded, the funds would be a little bit higher in 0 to 5 than it would be in years 15 to 18. So we may see a disbursement of $325,000 for the first 5 years, where it could dilute down to a very small disbursement in the last 5 years.
Yes, and so we have a sheriff's office, right? County attorney's office, human services, not just public health. I think there are this impacts a lot of our, but also the ability to support community organizations and other infrastructure within the county, our healthcare providers, EMS. I think there's an opportunity to build an infrastructure that outlives the funds,
Yeah,
hopefully.
be good.
We will provide the facilitation. Honestly, I was sort of waiting for them to introduce the bill and finish a couple of details before doing that, because I think a lot of partners will have the same questions when they come to the table the first time. Also, we're moving to a new building, so cart before the horse.
Yeah, a few things going on.
Yeah.
Mr. Chair, and you hate to talk too much about it and lead people down to believe that they could get money for it when we don't even know all of the
Yeah.
do's and don'ts with the money yet. So,
Yes. So I know that there is some interest from the state, and I really hope this does happen, to align what counties are doing and cities are doing with what the state is doing, because the money flows into the state. The agreement that the Attorney General's office made with local government was the disbursement, but there is the opportunity for the state to fund things as well. And what are they going to fund with their pots of money? What would counties fund? So that that also is something where we're hopefully going in a direction that gets us off somewhere. I mean, ultimately, it would be great to turn the tide, right? We have an opportunity with these funds that we didn't have with tobacco settlement dollars, where they're really directed at changing what happened.
And they're at the local level, which is a better opportunity to
Absolutely.
accomplish something than at the state level.
And I think the challenge with the EMS structure, with any multi-county or multi-jurisdictional effort, is getting everybody on the same page. So I don't know.
Yep.
Maybe not the first year that it's figured out, just because people, I think, are in different places with where this is at.
Well, the legislators will have it done in 3 or 4 years, so no hurry.
I really hope they don't take that. So that is one update I have for you. The other update I have is I just wanted to make sure, and I can send this in an email. I believe I have a flyer. If I don't, put John in charge of finding. But there is a, we are not having a Public Health Task Force meeting. We usually hold them on the same day as we have our board meetings every month here in April, because Buffalo Hospital and Centricare are hosting a needs assessment meeting and also covering the survey data. So that is when we will be releasing that to the public. I believe we will send you some information in email ahead of time. We received the data just this past week. I haven't looked at it at all. We had about 1,500 respondents, and if you remember, we put some COVID questions in there about how community members were impacted by the pandemic. So I mentioned we had over 1,500 responses. More than half of the people chose to write in comments and free response, and it sounds like the staff that have started to organize that information have found that it's very robust. People have put a lot of effort into putting those comments into the survey, so I hope that's really helpful information for you and for the folks in administration that are working on the ARPA funds. So we want to make sure that we give you a good product. So that is coming, and we'll be coming to you soon with the data and also all of those comments. We won't leave anything out, but we'll at least try to organize it in some way for you. And one last update that I have for you is that we had mentioned that during budgeting that the Child and Teen Checkup Program is expected to have some type of cut. We received a budget for 50% of our funds, which we already removed some staff time and made some adjustments. And we're expecting the next portion of our grant, which should be adjusted for how many our numbers get altered. I think we're supposed to get it in April. We would turn in our grant in July. But we still don't know who is going to be servicing our folks. We received a March 4th email update from the Department of Human Services. They have only received verbal commitment from Centricare and Alina. I don't know if they will complete the grant application or not. If they do, it's a 40% cut. If they don't, we receive all of our grant funds. If one of them does, I really don't know what portion of that 40% is Centricare versus Alina, how many clients they actually pick up. So just to let you know, we thought we'd have answers by now, but it's taking longer than expected.
Any questions? Thank you, Sarah. Anything else?
I have just one more thing. I so rarely have the floor, but I was directed, just like Sarah, to bring some director's comments. So I just wanted to share with you something that happened in financial assistance recently. Last week, a potential client came to the agency seeking cash, SNAP, and emergency assistance. One of our newer eligibility specialists, her name is Holly, met with the client. After talking with the client, the eligibility specialist realized cash, SNAP, and emergency assistance wasn't really what the client needed. Holly reached out to other areas in the agency to arrange coverage for chemical dependency treatment, and Terry Arvig worked to make that happen. She's at our HSC. Holly also reached out to arrange entrance into a treatment program for this client. So this interaction took a day or so of back and forth. Holly followed up with everybody that was involved. And so I'd like to say the story has a happy ending, but really the story continues. The client is receiving much needed treatment, and hopefully when that's complete, we'll be able to provide the assistance or direction she needs to get back on her feet. So, you know, I wanted to tell you that to show you what's going on well, I call it the third floor today, but next week it'll be a little bit different. And Holly's
It'll be the
comment.
second floor.
Then we'll be second floor. And then Holly's comment was this. She said, "This right here is why I truly love my job. I see people down on their luck, and I know that there are things that I can do to help. That is what makes this job so amazing."
Cool.
That's all I had.
Yeah, we like success stories.
See, but I like how, because getting them set up with SNAP and that was just a Band-Aid, and so it's like you got to fix the bigger issue so that the other part can actually do what it needs to do, and it would have been super easy for her to just go through that application process versus saying, hey, maybe we look at this first.
So there's a little more behind the story. Holly sent me an email. It was this long that explained exactly what happened. And the person really wanted housing. They wanted a place to stay. They wanted emergency assistance to facilitate that housing issue that they were having, because that's the only thing they saw as an issue in their mind. So she listened to them. She identified what they needed. She's like, if we give them emergency assistance to address this housing issue right at this moment, when this person gets out of treatment, we have no help for them because they will have used their emergency assistance within the year. So we're not up there to necessarily give out benefits. We're up there to figure this out for people. We're up there to truly help them. And that's what she did in this case. And she's a newer staff. She's here today. So I'd like to thank her for all of the hard work she's putting in. But it's truly our integrated services approach now that is, you know, really helping these people. So maybe when this person gets out of treatment, she'll come back to us, and maybe we'll be able to get her into her own place, and she'll have that happy ending. So that's what we're looking forward to.
Thank you.
Thank you.
Sarah, just the one thing on the solicitation letter.
Yes.
Did you want to pass the one around with the 4 names for
Yes.
signatures?
I can do that, or I'm gonna be at board tomorrow, but,
Oh, okay.
I
Up
can
to
pass
you.
it around.
They're all on there anyway.
Well, they're gonna,
We
like,
made one with and without.
Okay.
Sure, catch mark, since
Yep.
it hasn't been.
Yep. I mean, when the letter, our signatures automatically go on
They're all computerized.
their computer.
They have it.
They have all of our signatures, so.
Sure,
don't
I
have
can do
to-
that.
It don't matter, I can sign it too, it don't matter.
Oh, I need Commissioner Wetter and,
Me.
well, Mike is not doing it, right? Okay, just,
Yeah.
Want to do
I
it?
can sure
Do you
sign
want
it
us
too.
to sign them?
We sure can. Just
so
pass
you're
them.
here, that's fine.
Yeah, might as well.
Sure can.
all right, then
I
we're
didn't
gonna
realize
be,
there were signatures that existed. Apologize.
anything else then for the board? Okay, we'll adjourn at 2:44.